I am going to record the meeting, so just so you know. And so I just started the recording. And what I like to do in these webinars is this isn't necessarily me talking to you and hoping that you absorb what the content is, although I do hope that that happens. I find that these are much more beneficial for you if you're engaged in asking questions, even if you kind of get it, but want a little clarification. Getting involved and asking questions and digging in is the best way to get the most out of these, we find. So I invite you at any point in time to say, oh, hold on, Jeff, could we go over that? Or let's explore this topic a little more. And then if you had an expectation of something and I didn't bring it up, by all means, bring that up. And I've left some time at the end so we can kind of review everything that we have talked about and then make sure that your expectations were at least met, if not exceeded, on the content of the webinar. Okay.
Great,
So
thanks.
with that being said, I'm going to start by asking a few questions. And what I want to do is, with the questions, is as I go over, what I recommend and what I teach, I want to kind of incorporate what you've done, what's been successful, what hasn't been successful, and we can maybe kind of work through what's not working and make a change with the idea that with that change will improve things. So with that being said, one of the things that's not working, is it when you bring up the idea of treating patients with sleep apnea or snoring or Bruxism, um, and you bring it up, and do your patients just say, no, I'm not interested at this time, or what happens when you initially bring it up?
Actually, I'm gonna drop that to my receptionist because we talk about it in the clinical chair, and I guess I pass it to my hygienist as well. Because once I'm out of the room, I'm not sure what exactly is being said once they reach the front desk. So,
Okay.
Joanne, why don't you address that?
Well, I think in general, they're kind of in a situation of absorbing the information, and a lot of times it's, well, I'm going to take this home, I'm going to think it over, because I also kind of give them a breakdown of fee expectations, which is kind of, important in that kind of thing. I fill them in further, answer any questions that they may have, and a lot of times it is, maybe I'll talk with the spouse, maybe I'll think it over, or sometimes it's like, no, I don't think this is going to happen. And on rare occasion, one gentleman in particular, no, it ain't going to happen. So it's like they're trying to wrap their minds around it for the first time and absorb the information.
Okay. And Nancy, what do you get? I'm going to ask my hygienist what she gets in the hygiene room.
I get more of the technical medical aspect benefits than I do. They do as financials, but then I refer them to Joanne because I'm not that savvy on the financial end of it. They're more, look, I go into the more medical benefits.
Okay.
Because I'm actually not quite.
Okay.
Okay. So
that's kind of, I think ideally the first step we want to try to do before we even present, full fees if they need an oral appliance is, and I think Joanne's done this, is just to try to explain to them our fee, which you and I talked. We had set it like $250. That was what you and I talked about a year or two ago, and then at the midwinter meeting, you said, well, maybe if you just offered it for $100 just to see if they were more receptive. I don't know if the dollar is stopping them, the dollar amount, or if they're just not sure they want to do it. So what do you find is typically what works?
Okay, yeah, that the first bullet is develop the message, and when I say the point of that is, what's the strategy in the message that you're using to get buy-in from your patient? So we're going to spend quite a bit of time actually talking about that. And the second bullet there has to do with what your hygienist was referring to, and that's kind of, how do you talk about this from a clinical and technical perspective? And why would a patient do this? What are the health benefits to it? Okay. I do want to spend a little bit of time talking about your payer distribution, because that has a lot to do with if you're going to bill medical insurance, yes or no. Is there a large Medicare population there, yes or no? Because some of these subtle differences do have an impact on how you talk about it. So we will kind of go into that a little bit. The next question I have is I'm assuming initially this is a fee for service, and you're
Yes.
discussing those fees with your patients?
Yes.
And what is the fee that what's the numbers you're talking to your patients? You know, how are you talking to them about the fees?
Well, again, I think initially from a testing standpoint, we were shooting out $250 for the tests to determine if it was just a screening test to see, using the DDME device, to see if in fact they did have any obstructive sleep disorder.
Okay.
Most of the time we stop there. Our total fee for everything, if we did go to the sleep appliance, which we really only delivered one in the past year, was $2,600, and that included all the sleep tests that we would do before and afters, as well as all the follow-ups, the exam, everything that was in there. That was $2,600 for everything.
Okay. Gotcha. Okay. Okay, so that's good. I'm going to go ahead and get started then. And the first topic that I want to bring up, and this is every office, I would say, is guilty of what I'm about to talk about. And it has to do with asserting your dental authority. So, you know, that's kind of an odd thing to talk about, but let me kind of explain to you a little bit about what I mean by that. So, and I'll start by telling you a quick story about when I was in high school playing football. 26 got knocked out, so I have a kind of a gap right in the front, and you know where 26 is. And a couple of years ago, I had a dentist say, "Hey, listen, I can put an implant there." And I said, "Well, that's great, doctor, but where would I put my straw?" And I was trying to be funny and cute and clever, and that killed it for the dentist. He just went on to the next topic and didn't pursue the implant. And the reason that I tell that story is I fully understand that dentists, a big part of what you do is sell services to patients and kind of solve their problem. And I completely understand that part. But there's a component to what we're talking about today, which is sleep apnea, bruxism, and snoring, that puts this topic in a different scope of importance or a different level of importance. And that is the health consequences of unmanaged bruxism and sleep apnea. Okay? So, so the health consequences are very, very high. So what I'm getting at is when you're talking to patients, I can tell by the tone that you described to me what you did, the entire approach is I'm asking permission to do this. And we all understand, we know that's the case because the patient's going to say no if they don't want the service. But the tone in which you approach this is, okay, I'm going to tell you something and let me know if you like it. Okay, and if you like it, we can really help you out, and it's $250, and you know, and versus compared to, as a dentist, we now understand that bruxism and airway issues are interrelated, and we have a new service that we offer to measure that relationship. And I want to send a device home with you. The cost is $100, and it's important that we find out if there's a relationship between your damaged teeth and your airway. And we have next Thursday available. Are you available next Thursday to take a home sleep study? Okay, so the tone is completely different. And the way that I liken it is if you have somebody that's there for the first time, a brand new patient, you're going to give them an x-ray. Okay, and you're not going to say, hey, listen, can I give you an x-ray? you're just going to give them an x-ray. That's part of what you do. And I know it's not exactly akin to that, but it needs to be close to that. So as a dentist in a dental office, the service that you're providing, it can really, really help your patients out tremendously, both from a mental, physical quality of life and from a health consequence perspective. So for these two reasons, it's okay to be a little bit more assertive when you're talking about this topic than say if you were talking about teeth whitening. You know, if you said, hey, listen, we got this really great teeth whitening program, are you interested? And they said, no, I don't need teeth whitening. You move on to the next topic. If you're trying to help your patient live longer and save their life and improve their quality of life, you push a little harder when you talk about the subject. So, for example, when you have the initial conversation, and we'll talk about that, how that happens in a second, but so the initial conversation started, the patient probably has no idea as to why you, a dentist, would be bringing this topic up. Okay, they're saying, well, I'm here to get my teeth cleaned. I'm not here for snoring. And so, you guys kind of communicated that that's kind of like they have to wrap their head around, I think is the term that you used. The idea that the dentist is asking these questions, let alone wanting to charge $250. So when you bring it up, it's important that the patient understand why you're bringing it up. So early on, you bring it up, say, listen, we have this new testing that we do here in the office. It's $100, and what it tells us is how you sleep during the night, including do you snore? Is there any kind of pauses in breathing? Do you clench or grind your teeth? In the morning, when you come bring the unit back, we'll be able to kind of have an idea of what's going on, and then we can make some decisions on what the next step is for you. And if they have a little bit more to grab onto with regards to why you, the dentist or the dental office, is bringing this up, it's a much easier thing to discuss, and then then you bring up all the benefits. Hey, listen, this after we learn this test, after we get the results of this test, and it's really easy to do. It's going to take 10 minutes of your time going to bed and dropping off the unit in the morning, and we're really going to be able to have a snapshot of how you're sleeping. And when we can improve your sleep, there's all these benefits. Your mood gets better. You have increased vitality. Your risks go down for heart failure, heart attacks, high blood pressure. All those risks go down when we manage your sleep. So this is why the doctor is very interested in kind of just getting a snapshot of how you're sleeping. And I use the word snapshot a lot because it kind of just makes the test almost matter of fact. Okay, so it's important that you use a combination of, okay, if you don't do this, there's health consequences. Possibly, if you do this, there's all these benefits, and it's only $100. And so at the end of that conversation, I think if you practice a little bit, we will practice a little bit, you'll get much more matter of fact about the test, and you'll become much more convincing to the patient that it needs to be done if you, the person talking to the patient, really believes that, one, this really can literally turn their life around. We've seen it hundreds and hundreds of times where a patient doesn't even know that they're tired, and then they get a good night's sleep and they say, wow, this is crazy, I haven't felt this good in years. And so a lot of times people aren't even aware that they have the problem. And then as you probe and dig in and say, oh, listen, we've uncovered this issue and we can help you with it, you'll have the patient will have a completely different view of you and what you can do for them. So the point of this slide is asserting your dental authority, be a little more aggressive, be less timid, and the assumption should be that your patients need to be doing the test. Okay, that's the assumption. And so when you're ordering a test, the patient's expectation is, oh, I didn't expect to have to be doing this kind of testing. Or I don't know. So, I know this is kind of new in dentistry. A lot of people don't realize that how you sleep has a direct impact on dental health. And so it's important that we get the test. So, and when objections are raised, just kind of matter-of-factly deal with that. So somebody might say, oh, I don't want to pay the 100. I don't have the 100 right now. Okay. So then if you have some type of plan where you can do something for that patient, you know, they would ordinarily do it, but they don't have the 250 or 100, whatever it is you end up paying. If there's a financial plan for somebody that thinks it's a good idea but can't afford it, that's one thing. The next thing that I would do is if somebody says, well, no, I don't snore. I know I don't snore. Or I know I don't grind my teeth. Or I know I don't have sleep apnea. They'll say, I don't do that. And ask them, well, how do you know? I mean, you know, not to be kind of a smart aleck, but you're sleeping. So, how, you know, is it somebody that's listening to you and says, geez, it's amazing you don't snore? Because a lot of times people will do something in a very severe way and won't know they're doing it. And most of you guys have probably seen it in people with really damaged teeth or teeth that are worn down to a nub. You have these little kind of cow's teeth. And you say, geez, do you clench or grind at night or during the day? No, I don't grind my teeth at all. I don't know why my teeth are all worn out, but I don't grind my teeth. And it's the same thing with almost any sleep disorder. That's with snoring, bruxism, or sleep apnea. People just don't know they do it. So when you talk to them about this, they'll say, oh, well, I don't do that. Say, well, okay, you know, a lot of people think that, but the fact that you're asleep, you're in a little bit of a disadvantage to really know if you do that or not. And then when you're raising objections, or when you're dealing with objections, you know, make it personal. If you have something personal, say, well, my husband went through this, or my wife went through this, or my friend went through this, and they had no idea they had sleep apnea, and they wear an appliance and they love it. You know, it's made a big difference for them. So if you've done the test, you know, bring that up, make it easier for the patient to kind of accept that this is a normal thing. If you have some personal experience, that's probably the best thing to do when you're dealing with somebody that's kind of waffling on the fence. Say, you know, I totally get where you're at, but, you know, and I didn't think I needed to do the test either, or my friend, I didn't think they needed to do it, but we did it, and it turned out it was a good decision. So, you know, I'm trying to encourage you to do the same thing, and maybe we can help you financially make payments over time or something to just get this process started. Okay?
Okay.
Did you guys have any comments or questions on that part of things? Do you think?
Well, I think go ahead.
Oh, I was just going to ask, you know, based on what I talked about, do you think you're going to be talking a little bit different about to your patients?
Well, I think so. I think in dentistry, we've all been trained, and we've been to many lectures. I've been doing this 32 years, and you do ask for permission. We do ask for permission to take X-rays. We do ask for those things. You know, it's always informed before you perform, and so we do follow that mantra. So I think the shift for us is this potentially is a life-threatening or life-altering device or medical issue that, you know, we are now presenting, and so it's a different urgency, I guess, to the problem. Because we've heard all the objections that you've raised already, you know, in terms of I don't snore, I don't grind my teeth. So we see those things, and you know, I hate to say it, eventually you get to the point where you feel like you're beating your head against the wall. They're just not interested, and you've tried and you've tried and you've tried. You said, you know, this would really be beneficial. You really should find out. No, it's okay. You know, and eventually you just got to back away, or you'll obviously
right. You don't want to go too far, and then it becomes a negative experience. Yeah.
Right, exactly.
And I think sometimes there are a certain amount of people that really don't want to know that they have an issue.
Bingo.
They'll be forced to deal with.
And so that is a really good point, because it's, you know, I liken it to somebody with bad credit, and they know that their credit score is 450 or whatever a score is, and they don't want to know the number. And so when you made that observation, you're right. They kind of know they got a sleep problem, and they just aren't ready to deal with it. And if you sense that, you know, the part of the conversation that might change is say, you know, listen, a lot of us are like that in the sense that, you know, we kind of suspect that this might be a problem. We just don't really want to deal with it right now. And what we're doing in asking you to do a test is just to find out what the starting point is. And if you don't want to do anything with that information, that's fine. But at least you have a decent starting point, and we can discuss this over time where you're at. And you know, maybe sometime after we do the test, you become willing to get treatment for what we find, we won't have to do the test. You know, just kind of, you know, have the conversation and take it to its conclusion, whichever direction it might go. Um, and I think, you know, the arguments that you guys hear, I think really the main thing about this slide is that you just the expectation is that they're going to do the test. In your mind, it's probably not so much what you're saying; it's that you're really saying, well, what do you think about doing this? You know, or do you think this is a good idea? And when you ask the questions in those terms, it's really easy for a patient to say no. If you say, listen, the doctor's doing this new testing and it really can help you out, and it's inexpensive and it's done in the comfort and privacy of your own home, can we send you home with a device and see get a snapshot of how your sleep is? It's a little more difficult to say no when you phrase it a certain way. So just kind of think about that, and we'll move on to the next part of this. So one of the things that's probably happening, and it happens a lot, is that as a dentist, patients in the dental chair don't necessarily expect that you're going to be asking them about snoring or pauses in breathing or bruxism. Maybe the bruxism they might, but certainly not the snoring. And so what you can do and you may already be doing this, but what you can do is give a questionnaire out related to the quality of their sleep. Okay, so I'm going to show you some here in a second. But the reason that I bring that up now, go ahead.
We did one for, we did a newsletter. We sent out the Stop Bang one.
Oh, sure. Okay.
To like 400 people. And Joanne, what kind of response did we get on that?
Not a lot of buzz about it.
Okay, so that was
it went out to every.
Okay, so that was a marketing effort that you sent out, and they were the reply was based on the Stop Bang.
Yes, we sent out a newsletter about 4 times a year. We write ourselves, and within the newsletter, I had gone to a lecture by Dr. Carstensen at the ADA back in October, and there was a woman there, I think her name was Varga, and she talked about the Stop Bang test. So we actually included that as part of our newsletter, but we really had very little response, which to a certain degree was surprising. We had a couple people ask about it, but really, you know, not as many as I thought based on the age of my practice and the population of my practice.
Okay. All right. So the difference that bullet 1 is here, it's not really different. What I'm talking about here is different than what you did with the mailer. So the questionnaire here is something like, you know, going back to the analogy where you see a patient for the first time, you want to get some information about that patient as a dentist before you get started with them. And on the same thing, you want to, as you are implementing this into your practice, you want to get people to, when they're sitting there waiting for their cleaning or wherever they're there, say somebody from the front office, and they may even just do this, maybe not the Stop Bang. I wouldn't have sent that one, maybe a different one, but maybe the Epworth, where you just get a simple score, like your number, if your number is above 9. And say, here's a Stop Bang with 4 questions, and the Epworth, and 4 questions. The doctor's helping people with their sleep now because they're related to oral health, and I'd like you to fill this new questionnaire out that we have. They fill out the questionnaire and they give it back to the front office lady. So the idea there is, one, you're planting a seed, and two, you're getting ammo on the objections. Okay, so let me explain to you what I mean by that. So once they fill out the questionnaire, and there's, it's very basic, and I'll show you some. One, they're thinking, okay, I didn't know the dentist did this, but now that they do. So you're not introducing the topic. That questionnaire introduced the topic that you're now helping people with their sleep. So now that's kind of already kind of germinating in their brain. The other thing is, if there's anything that's unusual about their answers, okay, so they get their teeth cleaned, they're sitting there, and Dr. Reilly, you're going to see the patient for a minute or two. You would have that questionnaire and it says, listen, based on this, it looks like, are you tired during the day at all? And the person will say, they'll say, oh yeah, I'm tired a little bit. And then that's where you can say, listen, we have a test that we do now. We're going to take a snapshot of how you sleep, and let's find out why you're tired during the day. Okay. And when you have that, you're almost, it's tough for them to say no, because they filled out the questionnaire, and now you're following up with on the questionnaire. So, flipping this on its head a little bit, imagine now you're the patient talking to a cardiologist, and you fill out a questionnaire for the cardiologist, and the cardiologist says, based on this, it looks like you need this. Okay, you're not going to say, well, I'm not ready to talk about this yet, or I don't want to pay the $250 right now, doctor. I'll deal with my heart condition later. You don't ever see those objections because of the environment in the cardiologist's office. And in the same way, we kind of want to recreate that environment to the extent that we can. I know it's not a completely fair analogy, but we could improve a little bit if everyone just accepts that, dentists help people with sleep problems. And one of the reasons you come to the dentist is because you have the sleep problems destroy teeth. Okay, and there's other consequences too, which we'll talk about. So that's the first bullet. Visual cues. So you guys have probably passed this, but we have posters. If you want a poster that we can put in an operatory, and it just kind of talks about snoring and sleep apnea and stuff, and people can sit there and stare at it for a minute. They might bring up the conversation just because they've had to stare at that poster in your operatory. So that might be one thing. If you don't have a poster, we can send you a PDF, and then you can take it to Kinko's and have it printed up, and we don't have any charge. That's kind of included in our networking services that we offer. I already talked about bullet 3. Has anyone mentioned we are now helping patients who snore? Do you or your spouse snore? Just mention that. And if you mention that and they say, well, I know I don't snore, but my wife does. Say, okay, well, send her in. Let's make an appointment. We can certainly help her out with that. There's these oral appliances we can fabricate, and it takes care of snoring great. I mean, it does a great job of eliminating the snoring. So let's set up an appointment for her. See, now when she calls and says, listen, my husband said you can help me with snoring, you're sold. Okay, the patient's already got buy-in. So that's one of the benefits of just kind of bringing it up, even if you don't get a response. Just tell the person that says, no, I'm absolutely not going to take this device home, and no, you may not test me. You can say, okay, well, does anybody have a snoring problem? If they do, here's our card. Have them call us. Okay. Now, on the other hand, if you're talking to somebody and you've kind of get a favorable response, then if they haven't filled out the questionnaire, get the questionnaire going. And I'll talk about that in a while, because once you have buy-in, it's going to trigger some important activity. And I think the most important thing, maybe the second most important thing, is just when you're talking about the overnight study, be as matter of fact and blasé about it as you can possibly be. Say, listen, it's a little monitor. It's about the size of a pager, if you remember pagers, and you clip it to your shirt. There's a couple little sensors. You go to sleep. In the morning, you wake up, you put everything in the canvas bag, and you bring it back to the office. That's it. From that, we'll be able to tell a bunch about how you're sleeping, and we'll bring you in, and we'll figure out what we can do to help you out. That's the end of the conversation. I say, nah, not interested. No, why not? I don't have $250. Oh, we got a plan for that. We really do believe you should have this test that can really help you out. And the plan could be, and I know this, so far does not make good sense for you financially. But just so you know, what some offices do, and these offices are typically running a little more like you would hope. A lot of the patients that go through with the test end up with an oral appliance. There's like a 75 to 80% conversion from test to oral appliance. So what they'll do is they'll say the test is free, and they'll just raise the price of the appliance. So in your case, you said that total cost was $2,600. Well, maybe the total cost is $2,800, and the test is free. You could do something like that. That way, there's no upfront cost. You get the test, you show them the results, and when you show people pictures of what they're doing, you get buy-in. They're much more willing to write a check when you can say, listen, you snored 80 decibels 30% of the time. That's a freight train. We need to do something, and we can help you with that. Or it turns out, you do have a case of what we call sleep apnea. It's a medical condition. I'm going to get a physician to let us know what the best treatment for your apnea is, and we'll schedule an appointment and review the results with you. Okay?
And I think that's probably one of the holdups too, is because obviously we run the test, but it still has to be diagnosed by a physician. So I can show them, that we've taken the test, and yes, they have obstructive sleep disorder. Yes, they grind their teeth, but the true diagnosis has to be made through a medical professional.
Correct.
So that kind of stops us a little bit there, because we don't want to diagnose and then turn around and make them a sleep appliance, and when in reality there could be something else going on here that the physician would want to evaluate. So one of the things we need to do at our end, that you and I talked about, is establish a relationship with a sleep physician in our area. But I know you had also talked about the availability or possibility of having a physician at your end evaluate the sleep.
Yeah, so let me kind of go through what I'm suggesting here with you. So the patient agreed to go through with the overnight sleep study, and you've deferred the payment to you've built in the payment into the cost of the appliance. So they have no financial skin in the game yet. The patient does. And you've invested the $20 in supplies, and in the morning you have this download that we're looking at now, and you're sitting there with your patient. One of the things you can do to convince them that they should proceed with benefit is you go through with the patient what we're looking at. And you would just say things like, listen, this line here, and I'm going to do a little, there we go. So this part right here, that should be a flat line. Each one of those little spikes is a snore. You constantly snore, and in fact, your snoring is 86 decibels 77% of the time. Now, imagine a train going in your bedroom 80% of the night. That's what somebody's dealing with right now. Okay. Moreover, your apnea-hypopnea index, it's very likely you have severe apnea. And you use the word likely because, as you suggest, we haven't diagnosed the patient with anything. But we know that when your AHI is 30, that's severe. So you say, listen, we have a good idea what's going on here, and I really do think we need to proceed with treatment for you. And here's the costs associated with getting treated for your severe snoring and the likelihood that you have severe sleep apnea. Here's what their cost structure is. It's $2,850. and we can do care credit, and then we can also bill your insurance, and whatever we get reimbursed from your insurance, that payment can go to you. And so you can get some or some or a lot of that $28.50 reimbursed to you once medical insurance pays for the claim, because this is reimbursable by medical insurance. So then they'll say yes or no.
Yeah.
So at that point, oh, go ahead.
You find at that point you have the patients, you sat down, you've reviewed the findings with them, and they say, yeah, $28.50 will make the appliance. At that point, do you say, as part of the $28.50, I'm going to have a physician read this test and make a formal diagnosis for what you actually have?
Yeah. So as part of what happens when they agree, you kind of give them a rundown of how this works. Okay. So, and how it works is, just like you mentioned, first thing is I need to have a physician look at this data. I'll take care of that for you. That's included in the fee that we've discussed. That physician is going to come back with some recommendations, and you and I are going to review those recommendations and make a decision. That's step 2. Step 3 is, based on the decision, we're either going to send you to a sleep lab, which we need to find for you, or I'm going to take an impression and fabricate a sleep appliance for you. It just depends on what the physician, you and I decide is the best option for you. Okay? So, and you just have the conversation so they have some idea or framework of what's happening. And in the case of the data that we were I was just showing you, and by the way, that was done by a dentist that's thinking about buying a monitor with 0 training, and that data that you saw was collected from with that guy. So you guys know that this really is very easy for patients. I mean, it's so easy, even a dentist can do it. That was a joke, sorry. Maybe not a very good one, but in any event, so again, when you're reviewing the process with the patient, don't get foreboding. A lot of dentists like to say, oh, sleep apnea is life-threatening and you can die from it. Reggie White died from sleep apnea. The studies show that fear really doesn't motivate people to do something they don't want to do. They have to see an upside or a benefit to it. And so what we're suggesting is say, listen, this is really, it really has the opportunity to help you sleep better. It'll improve various aspects of your life. If you ever wanted to lose weight, when you're sleeping well and you're breathing well when you sleep, weight loss becomes much more doable and efficient, because one of the things that happens is when you don't sleep well, it's very difficult to lose weight. You just might kind of pile on some of the upside or health benefits and say, listen, this is, and by the way, the fact that you're doing this with me as a dentist, it's about 1/10 the cost of going through a hospital program. So you might want to mention that, because if they go to a sleep lab, the test that you're included, the $28.50 for everything, just the sleep study at the sleep lab is $3,000. That's just the test. So, you might mention, if they're struggling with, I don't know, I'd say, listen, if I take care of this and everything goes like it typically does, you're going to save yourself 90% of what the cost is, as opposed to going through the hospital. And it's the same exact path. Exactly the same path. So you might mention that. Okay, so that you've had the conversation, the patients agreed. I did want to kind of go back and talk about the questionnaire. Okay, and like on this one, I do have the stop bang here. So the reason I'm a big fan of questionnaires is if you're going to bill medical insurance, or if you're going to give your patient some documents so they can bill medical insurance, one of the things that medical payers need is a reason for doing the test. So the top part of this questionnaire is this is the Epworth, this guy right here. And the Epworth is not, to be honest with you, from a clinical perspective, it's not a great questionnaire. You kind of assess how likely you would be to fall asleep during the day. But the thing that makes this a very valuable questionnaire is payers just like it. They've just adopted it, and they have a threshold that if the score is 9 or 10, depending on the payer, that's positive for being tired during the day. So that's equal to somebody saying they snore, or somebody saying they've witnessed pauses in breathing, or they've fallen asleep while driving. Okay, so anytime you're going to order a test and it's going to be submitted to medical, you need to have a reason for the test. Okay, so this is a good reason. Stop bang, good reason for the test. Okay, do you snore? Yes or no? Are you tired? Yes or no? Anybody ever see you pause and breathe? What's your blood pressure? Is it high or normal? Is your BMI above 35? If they answer yes to any of these questions, one or more of them, that's another good reason to do the test. Okay, so the questionnaire does two things for you. One, it documents why you ordered the test in the first place, and it's good to know that about your patient. Two, it provides a document that you need in order for the patient to get reimbursed for doing the test. Okay. All right. I talked about visual cues. Okay, so the point of a visual cue is if the patient brings up the topic, then you have a lot easier job selling than if you bring up the topic. Okay, so if you have visual cues in your office, and they might not. They're there for a cleaning, and they're staring at this poster for 15 minutes, and they go sit in the chair, and now they're waiting for their hygienist to clean it, and the patient might say, "Hey, what's that poster about in the lobby?" Say, "Oh yeah, well the doctor has a new program and he helps people improve their sleep. We have a great program. It starts with taking this little monitor home. You put a couple of sensors on in the morning. You bring it back to the office, and we kind of get a feel for how you're sleeping, and then we'll decide how we can improve your sleep. Are you interested?" "No, I don't think so." "Oh, why not?" "I don't think I do that." Well, a lot of people feel that way, but the doctors found that it really helps quite a few people if we can just get an idea of what's going on when they sleep, because most people, because they're asleep, don't know. That's kind of part of the problem. No, I'm still not interested." "Okay, well, let us know if you ever are, and then let it go. And the conversations, once they start flowing kind of like that, then I think you'll find that people will be a little more receptive, and maybe not initially, but they'll come back, because believe me, most people that you talk to about this, they might say, "Absolutely not. I sleep perfectly. I'm full of energy and vigor all day long. And look at me, I'm a picture of health. I do not snore." Well, everyone can, sleep a little bit better. So if you ever change your mind and you want to get a test, let's get your test done. It's really easy. Believe me, it's the simplest thing ever. Okay, so kind of drilling down a little bit more into talking about this and how you can convert things that happen in your environment, in the office environment, into a sleep opportunity, is one I already kind of mentioned. You balance the message. You say, there are significant health consequences, but there's tremendous benefit to just dealing with this. Let's just do the test. There's no charge. Let's do the test. Let's see what's going on. And, if you're still apprehensive about proceeding, we'll just kind of give you a note and remind you next time you get your teeth cleaned. Okay? But balance the message. A little bit of good news, a lot of good news, a little bit of bad news, and say, here's the solution. We can kind of get rid of some of these risks and enhance these benefits by just agreeing to the simple test. Another thing to do is chipped, broken teeth are great evidence that you have a sleep problem. Okay, so you guys know. I mean, you say, "Oh, look, how do you grind your teeth?" "No, I don't grind my teeth." I don't know how all these teeth got broken, but I don't grind my teeth. Well, we find that a lot of people, what happens is they have some type of sleeping problem, and because they're asleep, they don't kind of perceive that they're clenching or grinding their teeth, but they do, and just because they don't realize it doesn't mean it's not going on. And the doctor's got a simple test, and we can send you home with this monitor, and we'll see what's going on. You know, in a lot of cases, there's some simple things we can do, and we can kind of prevent this damage from getting worse, and we might even be able to turn it around and improve some other things, some other health benefits as well, including kind of preserving your teeth. Let's schedule an appointment and send this home sleep monitor home with you. Okay, so that's another thing, using damaged teeth, because that's physical evidence. You can show them a mirror and say, see, these chipped teeth are a sign that you have a sleep problem, and the doc has a program for that. We can kind of prevent that damage from getting worse. So, you know, that's kind of an approach. The next thing that I talk about is people sleeping when they're waiting for you. Okay, so I've talked to a number of hygienists about this, and they talk about it almost with a sense of pride that my patients are so relaxed and comfortable with me, and I do such a good job that when they're waiting, they just fall asleep in the chair. That's how good I am. And that's probably true, but somebody who appreciates their hygienist shouldn't be sleeping, okay? And it's not because they're relaxed. It's because they have a sleep problem and they can't stay awake during the day. That's why they're falling asleep. Okay, so the patient does appreciate you, but the reason they're asleep is because they're not sleeping well, and given an opportunity, in a couple of minutes, they're out. Number one sign. You know, if you got to wake somebody up to clean their teeth, you know, that's somebody who has pretty bad sleep apnea or some other sleep disorder that's keeping them from sleeping well. So if you wake somebody up, that's an in for you. Say, listen, you know, I can't help but notice I had to wake you up. You've been kind of snoring a little bit. The doc has a new program, and you know the story. But falling asleep in the chair, that's a great introductory topic. Okay? They're going to say, oh, I'm sorry, I didn't mean to fall asleep. That's okay. No, we love when you sleep in the chair because it's a sign of a problem, and we can help you with it. Let's get started. After we clean your teeth, the doc will come in and he'll tell you what we're doing about people that fall asleep in our chair. Okay. All right. So from the first kind of part of this conversation, I want you guys to kind of develop your script. All right. So I've kind of gone through off the top of my head and said a few things, and you can copy verbatim what I've said, and I'll make this recording available to you. So if you want to play it back or whatever, you can do that. But I think the best thing to do here is to kind of fold in what we've talked about and add your own little part to the script. And I don't know what that would be, but just kind of use your imagination and make it your own little story. So when you talk to patients, there's a personal touch to it, because that goes a long way towards helping out with regards to getting the patient comfortable with proceeding. Okay. So, for example, if you've done the test yourself, or you had your dad tested, or your spouse, or somebody you knew who had a big problem and now they're doing so much better, whatever that personal connection is, when you're kind of developing your script, weave that into the story. Okay? All right. Okay, so we do want to talk about, I know this isn't exactly selling from the chair, but it is selling. Okay, so we're going to shift gears a little bit, and I'm going to talk about developing the relationship with your sleep lab. So that has to happen. Now, obviously, well, not obviously yet, because I haven't told you. The best way to develop a relationship with the sleep lab is to refer patients to them. So as you become more successful at getting people to say yes to the test, what's going to happen is you're going to start testing people, and some percentage of them, you're not going to be able to help. So you're going to do a test, and you're going to review the results, and you're going to have to say, listen, good news and bad news, actually great news, and a little bit of downside news. The downside news is I'm not going to be able to fabricate you an appliance. It turns out that due to status of your sleeping problem, I need to refer you to a sleep lab where they'll be able to help you better. Okay. It's a great lab. I have experience with them. They're good people. They're going to take care of you, and I'll follow up with them and make sure that things get moved along as they should. Okay. That's the bad news. The good news is they're really going to be able to make a difference in your life. That's what they do for a living. That's all they do. And it's important for me that you give that effort 100%. Okay. Because they're probably going to recommend CPAP for you, and CPAP's a great therapeutic option, especially in light of what we found with your test. It's going to be a great option for you, so you really need to give it a shot. Okay? Do not, and I repeat, do not say, well, if CPAP doesn't work, call me back and I'll make an appliance. Do not say that. It's not fair to your patient, because the reason that that's not fair to your patient is if the physician's recommending CPAP, that patient needs to really try CPAP, because the physicians that we use weigh equally the treatment options and only select the best option on the data. They have no stake on where the patient goes for therapy. So it's completely objective, 100% objective. So like for a sleep lab, when a sleep lab says, why don't you come back and do a CPAP titration study, they get a second study out of it. They get 2 nights instead of 1. And then they get CPAP, and a lot of sleep labs distribute CPAP. So the sleep lab's kind of invested in the CPAP outcome. The physicians we use are invested on what's the best thing for the patient based on these numbers. So when our physician says the patient should be sent to a sleep lab or try CPAP first, be very supportive of that outcome. The second reason you want to do that is if the patient follows through and they're successful at CPAP and they feel better, and all these upside occurs, and they get to experience all the upside of sleeping well, guess who gets the credit for that? You think the sleep lab gets credit? No way. That was a hassle. Dr. Reilly gets the credit for it because he started the ball rolling. Okay, so then you have a very grateful patient, and they're going to tell other patients, and you can kind of see how this can grow from that. So even when you refer patients out, it's still good for the patient, and it's an excellent marketing opportunity. Okay, so when you're referring patients to the sleep lab, you call them up, and I'm going to kind of refer back to a search or dental authority. You call that sleep lab up and says, you don't have an attitude, but you have confidence. Hi, this is Dr. Reilly's office, and we have a patient we'd like to refer to you. Do you have a referral form? And can you fax it over or email it over? Yeah, okay. And then they fax over the referral form if this is the first time you're talking to the sleep lab. And you fill that out on behalf of the patient. You take the physician's interpretation or the report, depending on which one you've done, with the referral form. You make a copy of the referral form, put it in your record, and say, listen, patient, here's your referral form. I've already called the sleep lab. They're expecting you to set an appointment. Take this report with you. They'll have a copy of it, but you need to bring this report just in case. And when you get home, call and schedule an appointment with the sleep lab. Okay, that's what you need to do. Now, when your patient schedules that appointment and you follow up, so somebody should follow up with the patient, some weeks later and say, listen, have you had your sleep apnea appointment or a sleep lab appointment? Well, no. Well, you need to make the appointment. Okay. And the reason that you want to go through all that is because, again, you're you're driving this. Okay. This is your program, not somebody else's program. So, I know this kind of sounds repetitive, but it's important that you guys kind of rethink or see yourself a different way. You have a tremendous opportunity to help your patient, and it's almost a moral obligation because you have this ability to really help them out, and you're asking permission. Oh, this is kind of an extreme example. This is almost funny, but if an ambulance driver shows up to a car accident scene and the patient's laying there kind of on the street, the ambulance guy's not going to say, hey, listen, can I help you out? They owe it to that patient to help them out. And the same kind of thing, not obviously that extreme of an attitude, but you do have the ability to really help a person out. So, if you come from that spot, patients will get that. They'll sense it. Right now, I think what they're probably sensing is I'm a little timid. I'm not quite comfortable talking about this topic, so I'm going to kind of be a little bit rigid on the way that I talk, and people pick that up and no thanks. If you talk kind of from, it sounds kind of corny, but if you talk from your heart and you say, listen, we have a program that really can help you out, and it's I can't tell you how easy it is. It's so easy, but it really will help you out. People will say, oh, okay, you'll see a difference. I can assure you, you'll feel a lot better about it, as will your patients. Okay, last topic here is I'm going to talk about sleep labs. It's important that you guys get associated with one. Once you've referred a couple of patients to a sleep lab because they're severe or we learned something else that indicates they can't use an oral appliance. And then what you can do is call the sleep lab and say, hey, listen, I'd be glad to do a 30-minute lunch and learn to teach you guys about how oral appliances work and what we do at the sleep lab. And set up a little demo. And at no point in time should you ever say, now listen, I want you to send me patients. You're just educating them on what oral appliance therapy is, and you're also educating them on what you're talking about. Okay, but you don't say, I know what I'm talking about. You demonstrate it by offering to give them an in-service, and you bring a couple of samples of oral appliances. You show them what's involved with an impression. You might talk about Bruxism because sleep labs don't care about Bruxism. And then, ask a few questions and say, hopefully now you have an idea of what's involved with oral appliance therapy. And as you're hooking your patients up at night, before they don't go to bed in your sleep lab, mention that oral appliance therapy is a viable option that a lot of people are choosing. Just kind of have that kind of conversation. The other thing that you would definitely want to say in the sleep lab is that the technology that you use to measure the airway in Bruxism is the same exact technology they use in their sleep lab. Okay? And they will realize that if they've seen any of your reports that you send over. They're very impressive reports. I don't bother kind of telling you guys how good those reports are, but they will satisfy any clinician in the country. Any board-certified sleep doc will look at this data and say, yeah, I'm very comfortable diagnosing based on this quality of data. No questions about that at all. And so you just need to make sure that your sleep lab understands you're kind of on the medical path and you're not using one of these kind of offline or kind of one-off technologies that dentists seem to get talked into buying that don't have a presence in a sleep lab. The monitor you use is used in sleep labs, okay? I just wanted you to kind of be comfortable knowing that. Okay, so that's kind of what I wanted to go over with you guys today. I hope that it helps. I hope we can make some adjustments, and I like to leave sessions with kind of some direct action steps that we can take that are different than what you've been doing. So kind of with that being said, did you, let me ask you guys real quick. Doing something here. Okay, so action step number one. What do you guys think is the first thing you're going to change to see if you can talk more patients into doing the test?
From my standpoint, I think I need to quickly establish a relationship with a sleep lab so that I have the opportunity to refer, if needed, a patient with severe sleep apnea. So I think I at least have to have that out, to further their treatment.
Okay, so on that, let's talk about that for a second. The area that you're in, do you have any sleep lab, hospital-based sleep labs that are close?
there's a sleep lab within like a half a mile of me, and unfortunately, every time I stop by, he's closed.
Okay,
So
yeah.
either I'm just
If a sleep lab's closed during the day, that's almost always what we call an IDTF, and that's an independent diagnostic testing facility. That's not the kind of sleep lab you want. The kind of sleep lab you want is
good.
kind of open during the day. And so rather that one's close, but those types of sleep labs are never going to yield you a referral. Those labs don't generate referrals. So we're going to probably have to pick a lab that's a little farther away, but a little more appropriate to work with.
And so you say a hospital base?
Yeah, well, it doesn't necessarily have to be a hospital base, but it does need to be a full service sleep lab, meaning you can refer that patient to the lab and a physician will see that patient at that sleep lab. Okay? Diagnostic testing facilities, they just will run the tests that you order. And then, they'll do the sleep study, but it's not the type of interaction, it's not that they'll never be able to offer the two-way interaction that you're wanting.
Okay.
So if there's no hospital sleep labs close or you're not comfortable going to the one that is, we need to find, let's find a lab that's in your area, and then give me a call and say, listen, this lab here, they are open during the day, and they do have a physician on staff that I can refer my patient to. That's the main thing that you need to be able to say yes to. When you call the sleep lab, can you say, can I refer my patient to your physician? Okay. And if they say, yeah, sure, we'll love to see your patient. Great. That's the kind of lab you want. If they say, no, you can't see we don't have a doctor here, but we'll do the test for you. Say, okay, I'll get back to you. And then move on. That's not the type of lab. Okay. So we still need to do that. I think that it will be comfortable for you to have that in place, but I wouldn't stop anything else waiting for that sleep lab, because what's going to happen is if you start having more success, you're going to probably in the first 5 patients, maybe the next one, they're going to be severe. Okay, so you're going to need a place, and if you don't have one set up, we're going to have to hustle. So rather than go through the grief of hustling to find a spot for your patient, let's look for one now, and I think you kind of have an idea of what the next lab is that you should maybe look into, and then let me know what you think or what you found out about that lab, and then we'll decide if it's a good fit for you. Okay.
Okay.
All right. What about number 2? Is there anything else we can do?
I think we need to work on our script, they said.
Okay. Okay. Develop your own. That's a great one. Okay, and on that one, the more sincere you are about it, the better. Just really, I cannot tell you how much saying, I can't believe my spouse is so much better. I just can't believe it. If you have the same benefit that I have, that's SC.
So bottom line, Jeff, if we weren't sincere, we wouldn't be doing it.
Yes, there you go.
Sincerity is pretty easy.
Yeah.
You believe in it.
Yes. And there's every office goes through this period of being timid about discussing it, because anything new, and it's like, I'm not all that comfortable and things. So just get comfortable talking about it and bring a little kernel of yourself into the conversation, and you'll be surprised at how that's going to get better for you. Anything else that we can do?
I think a couple things. Nancy said the questionnaire, although we have the effort scale right on the front desk, we've had it there for a year.
But they're not filled out.
No.
They're just reading it.
No.
So we can have them fill it out and make it part of
Sure.
Yeah.
Using the Epworth questionnaire, which we have at our front desk, but maybe we use it more as part of their actually having them physically filled it out, because we laminated it and put it up front. And then secondly, I think looking at our fee for the test and decide, do we want to offer it at a nominal cost, or do we want to offer it for free? And, you know, see if we, I mean, at this point, I've paid for the device and we've got all the equipment. It's just a matter of, you know, utilizing them.
Yeah, and you know, on that point, I'll tell you, if you do a test, and again, the supplies on the test is about $20, and then there's the paying the physician. We don't necessarily have to get it read. So, you know, in certain circumstances when it's really severe, and you have this patient, it's like, well, do you want to pay the $109 for the physician, or do you want to just refer that patient to the sleep lab and let them deal with the diagnosis? You know, that can be a judgment call. Either way, the patient's going to the sleep lab, and you know, there is some benefit to you doing the diagnosis, because then they can do a full night CPAP study instead of half the night diagnosis and the second half CPAP, which is what most labs do now. They would get the full night on CPAP, but it's going to cost you $109. So rather than that, then they can just go to the sleep lab, and the sleep lab will diagnose them and then do the second part of the test halfway through the night. So, okay, so I think that's good. Financial option.
And I'm
It's 10 years.
yeah, I've got almost 10 after. I've got patients waiting here.
Okay, you know, I'm done. So what I'll do is I'm going to save this as a PDF, and then I'll email you the presentation we went through,
Great.
and then we'll go from there.
Great.
Okay, thanks, guys.
Thank you.
Uh-huh.
Time.
Bye-bye.
Thank you. Bye now.
Bye.